Congressional Republicans have recently revived efforts to overhaul malpractice laws, including capping certain kinds of lawsuits at $250,000. A perennial argument of supporters of such measures is that many claims are frivolous, clogging the court system and driving up healthcare costs for everyone. But does the evidence support this? This is Healthcare Triage News. You don't have to look too hard to find backing for the notion that some malpractice claims lack merit. A 2006 New England Journal of Medicine study reviewed a random sample of 1,452 claims from 5 malpractice insurers. Its authors found that 37% of these cases involved no errors and 3% involved no verifiable injuries. It's also undeniable that defending against malpractice suits gets costly. Other research, which we did, shows that providers and hospitals spent, on average, between $81,000 and $107,000 in 2008 to defend cases that went to verdict. Even defending claims that were dropped, withdrawn, or dismissed cost $15,000 per claim. But it's not so clear that the best way to solve malpractice lawsuits is through changes focused on the legal system rather than the medical system. The same 2006 New England Journal of Medicine study also found that, in many ways, the system works reasonably well. Most claims without errors or injuries didn't result in payments, and most claims with errors did. A study published last month in the American Journal of Health Economics explored the link between malpractice suits and metrics known as patient safety indicators, or PSI. These indicators, developed and released by the Agency for Healthcare Research and Quality in 2003, are intended to quantify harmful events of the healthcare system. These events are thought to be preventable by changes at the level of the physician, the hospital, or the system itself. The study's researchers combined a number of data sets from Florida and Texas to see how the rates of 17 indicators were related to malpractice claims for hospitals. Their hypothesis was straightforward. Patient safety indicators are a reasonable measure of safety, poor safety makes medical errors more likely, and medical errors lead to malpractice claims. It turns out that hospitals differed quite broadly in PSI rates. In Florida, among the larger hospitals, adverse events range from 55 to 390 per 10,000 discharges. The researchers also found a strong correlation between PSI rates and the rates of malpractice claims. Bernard Black, one of the authors of the study and a professor at Northwestern School of Law, said that even small changes in patient safety helped a lot, and I'm quoting, "Moving a hospital from roughly the 33rd percentile, worse than 2/3 of other hospitals, to the 67th percentile, better than 2/3 of other hospitals, reduces the rate of lawsuits by 16%. This level of improvement should be achievable." This research is not the last word on the subject, of course. Patient safety indicators, while widely accepted as measures of safety and quality, are imperfect. This study includes only 2 states, with hospital-level data available only in Florida. The study wasn't a randomized controlled trial, and causality isn't assured. Causation is likely, though, because reverse causality doesn't make much sense. It's hard to see how higher malpractice rates would lead hospitals to pay less attention to safety. The study points to a significant link between measures of quality and safety and malpractice claims, suggesting that taking steps to improve patient safety should reduce the risk of lawsuits. Such measures would also probably improve outcomes for patients, a good in itself. Too often, efforts to fight the undeniable problems in the malpractice system start from the assumption that there are too many cases, that they're not real, and that we need to come up with solutions to limit them. But what the data suggests is that improving medical practices may be a more effective approach than passing new laws. Healthcare Triage is supported in part by viewers like you through Patreon.com, a service that allows you to support the show through a monthly donation. Your support makes this show bigger and better. We'd especially like to thank our research associates Joe Sevitz and Jonathan Dunn, and of course our Surgeon Admiral Sam. Thanks Joe, Jonathan, and Sam. More information can be found at patreon.com/healthcaretriage.